Hello, this is Ali Ajmal, your psychologist. Today we are going to talk about depression. Many people ask me, oh doctor, is depression so widespread, which is by the way a fact. Yes, nowadays depression is very much prevalent. But we need to understand some basic thing about depression. For many people, depression is one of the most understood concepts. Many people take depression into a different way. First of all, here I would like to tell you about some basic thing about depression before we come to its treatment. Okay, first of all, depression is of two kinds. One is clinical depression and the second is non-clinical depression. If we talk about the non-clinical depression, it's not a disease, it's just our behavioral aspect. It's just a condition, non-clinical depression. Okay, if someone is having a problem in his life, usually life gives us problems. So temporary, if you are having some problem in life, to be depressed, it's normal. It's not only normal, but it's quite healthy. That human is not a machine. If we would suffer, if we will encounter with some problem, any kind of problem, we will feel depressed. It's natural. There is no harm in it. Yes, but if we are depressed because of without any reason, because of nothing, and if we are depressed out of proportion, that we don't need to depress from something, but we are out of proportional depression, we are suffering from out of proportional into depression to great extent, then we say that this is not normal, or at least this is not healthy, because it wastes a lot of our energies. Then we call it clinical depression, which is by the way a disease. If you are suffering from clinical depression, there are some symptoms, some very obvious symptoms. In a typical patient of depression, first of all, mood. Yes, the mood would be not okay. Low mood, irritability, low energy, sleep problems, behavioral issues, adjustment issues, and above all, there would be sadness. So these are typical causes of clinical depression. Again, if we talk about these things can happen in our daily life because of a reason, but it's just temporary, then we don't call it clinical depression. It would be non-clinical depression and it would go with time. But if these symptoms are prolonging and if it is because of unknown reason or such kind of reason which were years back in your life and it's still persisting, that the conditions are not persisting, but your depression is persisting, then we say that this is clinical depression and we need to treat it. Okay, before we go to its treatment, let me tell you that why we should treat depression. The simple answer of it, that why we shouldn't treat depression. Depression is a name, untreated depression by the way. Untreated depression is the name of death. Yes, death is synonym of depression. A person who is suffering from depression, he or she is living. He is doing his daily work, but he is mentally a kind of dead person. No sense of pleasure, no energy, just he is pulled by his life, no control, no perceived control on life, helplessness, hopelessness. What is this life? This is not life. This is death. Life means energy. Life means livelihood. Life means progress. Life means happiness. So the person who is suffering from depression cannot feel happiness. He cannot feel pleasure. So that is why we need to treat our depression, because there is no good thing or there is no virtue to live a life without pleasure. There is no virtue to live a life without happiness. This life would be useless if we are not making progress, if we are not good for ourselves, and if we are not doing good to our loved one and to others. So a person who is suffering from depression, and why we should treat our depression, because it's synonym of death. Okay, so that is why you need to treat your depression. And by the way, one thing here it came to my knowledge when I usually check patient on my clinic, that people are thinking that if someone is suffering from depression, he is insane, which is by the way a fallacy. Depression has nothing to do with insanity. Insanity is a different thing. Depression is just a condition, as we can have fever, we sometimes have seasonal flu. So fine, we can have depression, we can suffer into depression. That's fine. It's not that that someone is insane. So we need to shrug off this stigma which is holding us back, which is not letting us treat our depression, which is letting us suffer and bear useless pain in the form of depression. Okay, how to treat depression? Well, to treat depression is a full-fledged package. You need to work on your behavior, you need to work on your thought patterns, and above all, you need to work on your personality. Usually a person who is suffering from depression have self-defeating thoughts. Like, good thoughts are rare in his or her mind, but the self-defeating thought, hopeless thoughts, and such kind of maladjusted thoughts are the daily pattern of a person who is suffering from depression. So this is a vicious cycle of thoughts which make us into depression, and which is not letting us to get rid of our depression. So you need to work first of all on your thinking pattern. Secondly, you need to work on your behavior, that our behavior should be positive and such kind of behavior which would help us in thriving, which would bring positive energy in us. And yes, we need to work on our personality. Sometimes it's not the depression who is making trouble for us, who is creating fuss in our life, but it's depression plus our personality problems due to depression. So if we are having such kind of personality flaws along with depression, so we need to first work on our personality. Okay, well, one thing I would like to clear here, that no one can fight depression alone. So don't try even. There is no harm in seeking some professional help. There is no harm in seeking some therapeutic help. You cannot fight alone with depression. This is crystal clear. So you need to muster up courage. You need to just realize yourself. Don't fight with your mind. Just realize that you are suffering from depression and you need to treat it. This is the one thing. Just you need to do it. Just realize that you are having depression and go for treatment, and your depression would be gone. Yes, due to your treatment. Okay, if you want to treat your depression, or if you want to consult me any kind of problem, you can consult me through following given number. I will try that we both together will fight your depression. We'll both find a way to treat your depression. Thank you very much. Take care.